I think for me personally, this was my own individual experience. I still dealt with the tummy issue, the bladder issue, all of that, but I just didn't care as much.
Right.
And then because it didn't go away, because that's what they try to tell you. Oh, your IBS will get better. Oh, your overactive bladder will get better if you do this. No, it doesn't get better. It just makes you not care about it. And then what do? In my experience, I was destroying my body.
Welcome to the studio, Maya, and welcome back, Katera. Okay, I want to begin with a disclaimer for our listeners, and that is just to say, this conversation, it's not intended to be a substitute for professional medical or psychiatric advice or treatment. Always seek the advice of a qualified healthcare provider with any follow-up questions or concerns you might have with respect to what is best for you and your health. I just want to make sure that's clear. We're not doctors or psychiatrists. This is just getting one person's side of the story on a topic that I don't feel is talked about too often, but it's something I've actually heard about more than just once. So that is the topic we're discussing today. So I want to begin by having you, Maya, take us back to when this all started. You were 26
Mm-hmm.
and you had just gone through a breakup that left you in a bad headspace,
Yes.
dealing with depression and irritability. And the next thing you know, you have prescription of antidepressants.
Mm-hmm.
And so let's start there. How did you wind up with the prescription, and when your doctor prescribed it to you, what were you told about it?
Well, I remember very vividly because it was brand new. It was when I guess we could actually look it up when Lexapro first came on the market. So there's probably a date. So it was so new that they weren't even prescribing it. It was just samples. So I remember I got samples of Lexapro. So it was that new. And the doctor was like, well, it's new. It's supposed to be amazing. Okay. So, I take it, and I take it for probably roughly, if I had to guesstimate, 3 to 6 months.
Mm-hmm.
And then all of a sudden, oh, and I had really good health insurance at the time. And they're like, oh, your health insurance doesn't cover it anymore. We got to put you on something different. So then that's what I did. And I just continued to stay on it.
When you went did you go to the doctor for that purpose? Did you go and say, hey, I think I need to be on antidepressants because I'm going through this
Yeah.
depression because of my break? How did that all occur?
Yeah. So it was just, I lived with the person, and it was one of the hardest things that I had to separate myself from. And I didn't have a lot of emotional support from people that I felt like I needed it the most from. And that was my biggest issue. And I remember going to the doctor. I mean, you go to the doctor
Right.
for help, and you're like,
Right.
okay, help me. I'm not feeling well. And at the time I had a trusted physician and nurse practitioner
Mm-hmm.
that I liked more than my doctor. So I saw her a little bit more than I saw my actual doctor. And she was always very kind to me. And I remember just going through the motions where I thought that working every day in tears was just not right. It just, I couldn't get up. I couldn't do the things I wanted. I mean, I got up out of bed every day, but it was just every day was just tears every single day, just
Right.
upset and, just.
So wait, so you went to the doctor saying that I'm going through this, I can't cope anymore, and they just said, okay, here's this prescription. Were you told
Yes.
anything about it or what to expect?
I mean, my recollection was they probably just told me, take it this way and start with this dose. And because it was such a new prescription, because it was samples, I just got whatever dose they gave me.
Right.
And it was just.
And had you ever been on antidepressants prior to that?
No.
And there probably no thought about whether or not this was going to be a permanent fix or temporary or how it would affect anything.
Nothing like that.
No thought of,
Yeah.
okay, of what direction it might go.
Yeah.
Was there any conversation about therapy, or did the doctor advise you to couple therapy with it?
No, not at all, really. I mean, I think I was seeing, a therapist or trying to see someone at the same time. And I
Mhm.
think I was doing that on my own.
Okay.
But I'm sure the doctor, I mean, if I had to say yes, the doctor probably did suggest it,
Okay. Yeah. Okay. So just on a side note, I want to ask Katera about this, who is a licensed marriage and family therapist. Why is it so important to couple therapy? And I want to ask you specifically, because you and I have actually had these
Mhm.
conversations. Katera is somebody that's very close to me. She's our therapist. We've talked about this. Um, and we've talked about the importance of coupling therapy with antidepressants. What is it about joining the two together that is powerful and necessary? for most people?
Well, I mean, I think it's important to first differentiate the purpose between medications and therapy because there tends to be a lot of confusion when speaking on this subject. So, in which I've had to explain to many of my clients and people that I know. I mean, the role of medication is to help reduce symptoms. That's pretty much what medication is for, whether it's anxiety or depression. But therapy teaches a person coping strategies on how to manage those symptoms. And while medication can be really effective for many people, there's a tendency to become, reliant on it
Like a
because,
crutch?
yeah, because
Mhm.
let's face it, it is much easier and more efficient way to treat their symptoms
Mhm.
rather than spending the time meeting with a therapist to address, their issues that they may not want to confront directly.
Mhm.
And what a majority of people may not understand is that medication in many instances is not meant for long-term consumption. So when a doctor refuses to continue prescribing like an antidepressant or especially an anti-anxiety medication, that client's still going to struggle with symptoms because they were not really addressed.
Right. Right.
So combining medication in conjunction with therapy can really increase like the treatment effectiveness.
It's funny because this is slightly off topic, but I think it's very relevant for right now, and I think you guys will both agree. So, the Ozempic craze that's going on right now with the
Yeah.
weight loss drug.
Yep.
Well, a lot of, and I'm a curious person, as we know. I'm not trying to lose weight, but I'm like, what is going on with this? And the the advice that I'm hearing from doctors or whatever is that use this opportunity while you're on this medication to start changing your lifestyle behaviors and exercise and eating. And while this medication is sort of helping you with coping with some of what got you there.
Mhm.
Does that make sense?
Yeah.
And that way, when you wean off of it, your lifestyle, you know what I'm saying? You've
Right.
Yeah.
improved some of those bad habits. So it kind of reminds me of that.
Mhm.
Um, but you're saying you were on therapy. Do you feel like,
I
or
mean,
not on therapy?
yeah. Well,
You
In
were
therapy.
seeking in therapy. Thank you.
I was on my own actually through my job at the time, and same job I currently have, but they actually have programs where they can get you into someone. And I remember seeing this woman, and I remember the entire time I would just cry the entire time talking to her, and she was so sweet, and she was a really good listener. I'll give
Yeah.
her that,
Yeah.
but I don't feel like I got any real help from her. And then I think that I was off and on. I did find this one woman. I can't remember her name, but she was pretty good, and I went to her for a while, but it was so long ago. I just remember like bits and pieces. Like I would go and I wouldn't. It was never addressed. It was never like the doctor followed up. Oh, are you seeing it? That never was coming out of their mouths.
So you were
Ever.
not getting like a momentum,
Yeah.
building a momentum with therapy. Because I know
Yeah.
with therapy, as I understand it, Katera, it's like one week leads to the next, and
Mhm.
you're hopefully picking up some.
Yeah.
Yeah.
Some
Okay.
coping skills of some sort.
It
Yeah.
wasn't until I got off of them that I was seeking like a huge amount of different types of therapy and psychology and
Once you realize what's underneath all
Mhm.
that kind of thing. Okay.
Yeah. So
Interesting.
definitely during no, just on them and taking them like little candies in the
How did
morning.
it? How did it help? Did the antidepressant? I mean, yeah. How did?
I'm gonna be honest with you. Like here, I went through a phase where I was 26, 27, and I was single and I got my own place. I was able to get this really nice place. I was partying and going to happy hour like religiously.
Mhm.
Like that is what I did. I went to work, I went to happy hour, I drank too much. And, one of the things it says clearly on the bottle, or not
Mhm.
even on the bottle, does it even say it on the
It
bottle?
does.
I
Yeah.
think
Okay.
so, yeah.
It
Well,
does.
I never read the bottle. So I just remember thinking like, and then the doctors will say loosely, oh, you can have a few drinks on them, or it's okay to drink moderately, but who does that?
Mhm.
Who drinks moderately?
I drank when I was on them.
Yeah.
I didn't even think about it.
Yeah. And so that's another thing that doctors just say, you can drink moderately. But
Don't you think
yeah.
some people's tolerance is different though?
Oh
Exactly.
yeah,
Yeah.
for sure.
Yeah.
100%.
Yeah.
I gained a tremendous amount of weight
Mhm.
when I was
Mhm.
on them,
Do you think that well, okay, so two things. One thing
Mhm.
is I think it's tricky with insurance. I think that insurance companies are happy to pay for the prescription
Mhm.
and with very little out of pocket costs
Mhm.
to the patient typically. I find that ongoing therapy is less accessible, and as far as an ongoing good therapy is less accessible to the patient and
100%.
insurance companies. It's not always covered as often
Uh-huh.
as like Alexa Pro would be.
Mhm.
And so and so many of us, and I have been in these shoes before, are looking for that quick fix. You just want to feel better.
Yeah.
You will do anything just to feel better, just take the edge off. And so once you feel better, it's like, I don't even want to think about this. I just want to get back to living my life. And I
Yeah.
have been there, believe me, for a decade probably. I was in that spot. So I totally get it.
Mhm.
But what was the second thing I was going to ask you? Oh crap, I already forgot it. Sorry. Anyway, what were you just telling me?
Well, I just want to say,
Yeah.
oddly enough, now that I'm thinking about it in front of you, Lexapro is what I actually got back on to
Yeah.
taper off all the feelings I was having. So
Okay.
when I started it, it was so new, wasn't even
Uh-huh.
covered by insurances. So new.
Yeah.
Okay, handed it out. Then when I was coming off of everything and I was coming off the Celexa, and I tried to just taper off that way where I was chopping it up smaller and smaller.
Right. Which
I
we're going
had-
to go through that.
Yeah. Lexapro, actually, I got back on for 6 months
Okay.
to get completely off of everything.
So
Mm.
when you went to your doctor
Mhm.
for that first prescription, you probably don't remember, but I'm just like, always hindsight's 2020, right? I think we
Yeah.
all do that. Like, what could I have done differently to save
Yeah.
me from all of this? Like maybe, I mean, how could it have been done differently? Maybe the doctors say, hey, we need to focus on some lifestyle improvements or changes. I mean,
Yeah.
looking back, do you wish you had never started them?
I wished
I mean, I know we're going to
that-
get into why
yeah.
yeah.
I wished, yes, some of those things. I wish that the doctors could have been a little bit more,
More education.
more educated. I was a young, I was mid
Right.
to late 20s, which is still very young.
Yeah.
Looking
Very
back on-
young. No, yeah.
I still feel very young at 45.
Yeah.
Yeah. So yeah. And I don't really recall, now that we're talking about it, I don't recall them really telling me, oh, make sure you're in therapy, or, that's not anything that really came out of their mouths. I'm just,
I think honestly it's
Yeah.
more popular now.
Yeah.
For people to
More
be
so
talking-
now, yeah.
more,
oh
in
yeah,
therapy.
it talks about a lot more
Yeah.
now. Yeah.
I wish I could remember what I was going to ask you. It will probably come back to me. But okay, so the first few years on the medication, you said you didn't really understand why you were taking it.
Well,
like
I
you were-
just,
yeah.
just, when you're in tears all the time, when you're emotionally drained from, just feeling hurt, from feeling sad, and my relationship with my mother wasn't the best. And when I would try to talk to her about it, it was the only person that can really relate to this conversation would be my little sister. We talk about it all the time, where it's like we go to our mother, we want to say things, and we want that help from her. And it's just, why did we say something?
Yeah.
It was tough. It was, and looking back on it now, my mom herself didn't have the best relationship. So what she could really compare it to, I don't know,
Yeah.
So it was kind of one of those things where I look back on it and I just really wanted some help from anyone. And it just wasn't getting that type of emotional support. And the antidepressants were a quick fix, but also I just felt just so desperate,
Mhm.
just desperate to feel better, desperate to want to make myself feel better, to get over this feeling of just, wanting to not hurt over this person or hurt over what was going on inside of me,
Yeah.
So
I
it's
think everybody can relate
yeah.
with that.
Mhm.
And-
Yeah.
But the difference is that some people do have the support network and they have family and friends who can really be there for them. And then those who don't, what are you supposed to do?
Yeah.
If nobody's pointing you towards getting proper therapy and believe me when I say I am not dissing on antidepressants. They helped me. I was on them for a while. They've helped me.
Yeah.
I'm on currently a medication where a component of it is an SNRI.
Mhm.
So I understand the need for them. But I think sometimes there's an over prescribing that occurs
Yes.
when breakups happen all the time, right?
Yeah.
So sometimes you're prescribing a medication that can have all of these side effects that you are not prepared for, you didn't know about, when really you just needed to heal from your breakup
Yeah.
in a maybe
Well,
a different
weight
way.
gain alone is a huge, and I've discussed that with doctors, like, well, what quality of life or weight gain? I'm like, no one wants to gain weight. Nobody does. I mean, some people that are too thin want to, I suppose, but I
But
mean,
Most people
yeah.
don't.
Yeah, but
Yeah.
but it does sound like looking back that there weren't a ton of other options being at least suggested to you.
Yeah.
Is what you're trying to say. Okay.
Yeah.
All right. So let's talk about the physical side effects. What first of all, you said your doctor didn't even bring up some of some of the side effects that you could experience? That was not a conversation.
No,
No?
never,
Okay.
never.
Did you know when they started where they were coming from?
Well, so one of the biggest towards the end when I was really deciding I wanted to be off of them, I was married at the time. And I remember like I'd wake up from sleeping and I just felt like I ran a marathon. I was never, I would have these vivid dreams, like just very vivid dreams. And I would just feel like I was awake the whole night, but I was sleeping. And these dreams, I still dream, but it was different when I was on them. It was just like I didn't feel like I slept the whole night and my body was unhealthy. I was drinking a ton of coffee. I remember I would wave my hand up in the morning. My ex-husband was Italian. We used to make espresso shots in the morning. And I would just like hold my arm up in the morning and be like, oh, a shot of espresso. Like I just, that's how I would get up every morning. I wouldn't exercise.
So they made you groggy-ish? Is that?
I just didn't sleep. You know, and it was years and years and years of taking them to the point where I just wasn't sleeping. And then when I really started to figure out, okay, you know, like I feel so terrible. I feel so terrible. And I would looking into it. And I went to see a couple naturopaths and some different people that did the muscle testing that we talked about. And I was on birth control too. So it's another subject, but I mean, I got off like everything. And I just was trying to make myself healthier. But detoxing from all of that was just like, yeah, it was.
So prior to getting on them, you didn't have sleep disturbances?
I was always not such a good, I didn't sleep well ever really. But I remember that made it so much worse. Plus, pounding espresso drinks and coffee didn't help either. I gave up coffee. I don't drink coffee at all.
Wow.
I gave up coffee completely.
Wow.
Yeah. So
can't imagine.
yeah, exactly. People can't imagine it either. The anxiety, all of it combined, you know, like I remember there was a few people that stood out in my mind. It was, you know, an assistant. It wasn't even like a doctor. She kind of said to me, you know, when you have a, you know, mind that is active, it's always like that. It's not just the antidepressant. I had so many key people tell me little tidbits that weren't even a doctor, you know, and it's like the doctor, you look to doctors to help you and to say the right things, and they often don't.
Wait, what did she mean? She meant you had.
So I remember I was so desperate for help that I would be sitting in the, you know, doctor's office and the help me out with
the assistant,
the medical assistant.
The medical assistant, yeah. They had like these bright things that they were saying to me. And I remember thinking like this one time I was just saying, gosh, you know, I'm just not sleeping. She's like, well, you know, if you have an active mind, because I have, you know, always thinking and all of things, you know, so she was like, then that's how it is regardless. It just intensifies. So I feel like the medication.
She's saying the medication intensifies that?
Yes.
Oh.
Which made perfect sense to me. Because that's when I was like, oh, you're right.
I've never even heard of that.
I haven't either.
It made sense to me. And right after she said that, I was like, because you have to kind of just accept who you are. You know, like I have a creative mind. I'm artistic, and I, you know, I like, you know, creative things. And so when she said that, I was like, okay, like I think about stuff all the time. I'm always curious about different things and subjects, and that's why when I was asleep at night and dreaming about all these things, it just is intensified even more, you know.
Okay. So you slept, but you were not getting restful sleep, basically.
Not at all. Not at all.
And then with the overactive bladder and like the gastrointestinal gut dysbiosis, was that all also credited back or attributed back to?
So that got worse because I was doing so many unhealthy things for my body, the drinking, the eating poorly, you know, because when you are on antidepressants, not everyone, but for my situation, I just didn't care what I did, how I hurt myself. And I was hurting myself every day. The drinking, the eating poorly, the weight gain, the things I was doing, the staying up all night, all those things that I just had a big party life. And even when I met my ex-husband, we met in a party life atmosphere and we kept the party going as we were married. And it was
so interesting how it affects people so differently.
Yeah.
Our bodies are so different from one
Yeah.
another. So
well, and then some people, and I was just discussing this with my friend, you know, you can meet some people that their skin looks great, they look like they're healthy, and they drink every night 100%. And they're fine, you know, and it's like my body was just basically saying, stop, you're hurting me.
That's where it's like, I don't know, like, I'm not a medical professional because I don't even know what I'm talking about right now. But I just think like, how are they not screening these things a little more carefully?
Yeah.
Like some of the stuff, like it seems to me like they should be like, you know what? Like I feel like with opioids, like they screen pretty well for that because of the crisis and everything. But sometimes I feel like with the psychiatric stuff, they don't screen as carefully.
Yeah.
And it sounds like sometimes there could be situations where you're really playing with someone's, not just their mental health, but their physical health. And yeah, it could create all kinds of problems if you're not careful. So I think by and large, it's probably you don't hear about this stuff that often, but it could be catastrophic. I don't know. That's what it sounds like
And
to me.
sensitivity to medications, I mean, is everywhere for everyone. And I mean, I can't tell you how many times doctors have said, "Oh, well, that doesn't happen. That won't happen," or
Right.
that's
It's very rare.
Until it does.
Yeah.
Can I ask you how high you were on? How many dosage?
Oh my gosh, I can't even remember. I could dig back into it.
I think the starting is like 10.
5 or 10.
Five?
10.
Okay.
Yeah. And then maybe I got up to 20.
Okay, so
yeah.
not crazy.
I wasn't
so it didn't
crazy
take
high.
very much. It did
Yeah,
just a little bit. And
yeah.
that's what I was thinking, like, did they have you on like 60 mil? Like,
Right.
how?
No, I wasn't that high. And I remember like requesting not to be that high. And but
Well,
yeah.
20 milligrams is, I think,
Pretty typical.
higher side of normal, maybe. I don't
Yeah.
know.
Well, yeah, it just depends on the medication.
Yeah.
Okay.
Yeah.
All right, and then okay, so then you met your now ex-husband.
Yeah.
Right? You guys got married when you were 31. About like a year later, you decided you want to start a family and try to get off the medication, and you went to your doctor to ask about weaning. What was the protocol that she gave you, and what was your experience with that?
So her protocol, and I remember my doctor, she was just very like cut and dry, black and white, and she's like, "Okay, well, you need to just take one every other day." And I'm like, "Every other day?" And I just never forget that. I thought that was so strange.
So weird.
And it made me literally crazy. And, with my ex-husband, he would, question, "Why are you taking this? Like, why are you unhappy? Like, why are you doing this?" And so when I went to my doctor to talk to her, that was her recipe to get off of it, was to take one every other day, then one every other 2 days. And I remember that's when I started to really go cuckoo. Like, it was just like, what,
Yeah, because your body's not like skipping a whole day.
Yeah, it was just, that was what she had asked me to do. And I thought, that's so weird, And then it wasn't until I went to go see and I'm so sorry because it is very cloudy, because it was a tough time in my life because I can't remember every detail, but I did see a couple different doctors. I did try to taper off. And then it was my oldest sister who was like, "You need to like chop it up smaller, and then get off of it that way." And I was like, "Oh, that makes a lot of sense."
That's
and so
what they do with opioids.
I know.
Right?
So I did that. And then once I did that, then I started feeling really strange, because I was off of it completely and my body was just detoxing from it. And I remember very vividly this one incident where I was in a room at work. I was upstairs in the lunchroom, and I just started having this weird out-of-body experience where I was having, I guess, a panic attack. Because some people talk about panic attacks all the time. I never had a panic attack. I mean, I have times where I feel panicky, but I don't like an actual panic attack. I've heard them described, and I remember thinking, I have to get out of this room right now. And I left and I walked down the hall and I went to the bathroom and I looked at myself in the mirror and I was like, okay, I'm here. Everything's okay. Like, I had to talk myself down, and I didn't tell anybody. I just went to the bathroom. And I remember thinking, I have never had this happen to me before. This never happened to me before I got the antidepressants. This is very strange. This is something I can't explain, and it was just bizarre. And it never happened to me again. It was just the one time, but it was really weird. I hadn't been drinking. In fact, I got off alcohol completely, stopped drinking coffee,
at this point,
alcohol, everything.
Because you were going to be wanting to get pregnant and everything, right?
Yeah. So I was trying my best to just be healthy. And that's another thing too. That's what you have to do to be healthy. Just be healthy. People have such a tough time with it. Like, no alcohol, doing the best thing that you can to help your body. I mean, I was trying so hard. It was tough. My husband still drinking, still doing those things. So it was tough, but he was very supportive. Oh, you know, in a way he was very supportive. I give him credit because he definitely saw the mental anguish I was going through. My mother did too. My mother helped out a lot with it as well. She actually paid for Michael Quaker. Can I talk about him?
Yeah.
Yeah,
He's my doctor.
Yeah, okay, yeah. So she helped me with that. There's no way I could have afforded.
So he does a lot of holistic, but he's an MD.
Yeah.
Right. Yeah. So he does both.
Yeah.
But he's very woo woo.
Yes.
He's very into homeopathy, but it works really well.
Yes.
Yeah.
So
and it worked well for you, right?
There was a lot of that. Yes. There was a lot of, I did both holistic and Western met it in the middle. Yeah. Type of thing.
To help with the detoxing.
That and just help me get my head on straight because he actually got me on a 3-month leave from work and I hadn't even thought about that, but I was not at this point was not sleeping at all. So I went from sleeping with dreams to not sleeping at all. So I just wasn't sleeping. I went through months and months and months of that where I just couldn't sleep at all. And I'd given up coffee and that was tough, you know.
Lack of sleep is definitely affects your
Yeah. So it was like all of that. And then I was taking low dose of sleeping pills, lorazepam, I was taking a few different things that were just making me feel worse because they would work and then they wouldn't work. But I was going to all, neuro doctors. I was desperate
so
for
your
help.
Chief complaint at that point was the sleeping issue.
Yes.
Probably.
Yeah.
Okay.
It was the sleeping issue. My body always felt tingly, like I couldn't relax. I could feel everything in my body, the stomach issues, the overactive bladder. It was a nightmare.
Well,
yeah.
I wonder how much of that, I'm not sure how it is with antidepressant. Well, I guess it would, it makes sense. I mean, don't they sort of hijack your neurotransmitters a bit? Because I know with my prescription, which is an opioid / serotonin norepinephrine reuptake inhibitor, it's tramadol. Those hijack my neurotransmitters, and I know when you're off of them, you're like wonky because they're not working. They've always had this helping hand that's sort of doing the work for it. And so you take that hand away and then it's like having, right? Is that, so you experience some instability.
I was trying to seek out different doctors and because I remember at the time my insurance wasn't covering anymore because I was still working for the same company, but I also my insurance for some reason wasn't covering for Sutter anymore. So then I switched. I was trying to go to UC Davis. I remember one incident where I was talking to a doctor and I was telling her my feelings and how it's just someone brand new, didn't know her. And she had said to me, I think you really should get on something. And I said, well, I'm trying to explain to you that I don't want to do that. It's just, this is how I'm feeling right now. And then I said, let me ask you a question. If you prescribe something to me, because I was hearing lots of cases where people were feeling suicidal when they got on something or also, just killing themselves, Right. So I said, because this is what she said, her exact words were, or if I don't advise you to get something and I'll prescribe you something and you kill yourself, I can get in a lot of trouble. That is what she said to me. And I said, what if you prescribe me something and I have a bad reaction and then I kill myself? Do you get in trouble then? And she looked at me and said, no. I'm like, that makes a lot of sense. It was just so bizarre. I would have these interactions with doctors and I'm like, how are you a doctor? Right. It was so, and I mean, this is a true story. And even with my doctor, previous to that visit, when I was trying to ask her for help, she says to me, you need to be on this, Maya, forever, for the rest of your life. And I was like, what? And when she said that, I was like, game on. Like, what?
Challenge accepted.
Yeah, I was like, how do you know that about me? And so it was just, I was not getting any support from the medical doctors. So Dr. Michael Quaker definitely was a breath of fresh air. It was tough. Yeah.
So after, it sounds like once that all worked itself out with the neuro, because I don't know what I'm talking about, but I think it's neurotransmitters.
Yeah.
Then it became more about the physical issues.
Yes. More about the physical issues.
Okay.
And I was going to physical therapy for my bladder issues. And I was going to all different types of doctors that were doing not Reiki, but like I did Herb Akers, another guy that kind of helped me. I was going to see him. He was doing like this muscle, basically deep tissue, just trying to get the body in line. And I was doing all kinds of stuff that I had paid out of pocket for. I will say that it was expensive.
Can I ask, so
Yeah.
with the physical stuff, because I know for the listeners, first of all, a lot of people are on antidepressants. A lot of us either have been on them or are on them.
Yeah.
And sometimes we have physical issues and we don't know if they're coming from that or if they're something that's completely unrelated. Did you ever talk to your doctor and your allopathic primary care doctor before you got off of them and say, hey, are these pills doing this to me? Like, was there ever a conversation about
No.
whether or not that was side effect related?
No.
How did you come to learn that actually could be due to the antidepressants?
Well, now that I think about it, and all of different types of people that I've seen, like people that do massage, it intensifies. So your body is already a certain way. You know, you're sensitive. I'm a very sensitive person, okay, just to everything, emotionally, physically. So when you already have the sensitivity and you're taking something that blocks, like, okay, because I think for me personally, this was my own individual experience. I still dealt with the tummy issue, the bladder issue, all of that, but I just didn't care as much.
Right.
And then because it didn't go away, because that's what they try to tell you. Oh, your IBS will get better. Oh, your overactive bladder will get better if you do this. No, it doesn't get better. It just makes you not care about it. And then what do? You're destroying your body because you're not, in my experience, I was destroying my body because I was doing the things that were wrong for my body, my individual body, and I was hurting myself by eating the wrong foods, drinking all the time, all the things that I did that really just made me feel worse.
Yeah, so basically it desensitizes you.
Yes.
It desensitizes
And
you to this.
I truly feel like that's what it does. Now, one could argue, or someone have a different experience, but
well, I don't know. A lot of people talk about that, like the numbing effect.
yeah.
Oh, I hear it all the time.
Like, I should be sad or I feel sad, but I'm not.
The lack of emotion.
Heartbroken. Yeah, exactly. Yeah.
And I think,
which is not a bad thing for the right. I feel like that should be said. Like,
yeah,
there are instances, obviously, in circumstances where it's appropriate, and there's other like life issues that we should all know, have the tools and be equipped to handle without, a synthetic.
Like you don't want to feel depressed, but you don't want to like have absolutely no emotion.
Right. Yeah. Like creatives have you're creative.
Yeah.
Creatives have a hard time with it because it numbs their. Right.
Yeah.
I don't know. Did you experience that?
Yeah, for sure. I mean, I I journaled because it was, people often, everybody journal. I looked back on my journals during that time frame. I never want to read those journals again. It was like reading a horror film. This is how I felt. Like it was bad. It was bad. I think I found something a few years ago or maybe months ago, and I find things, I save everything. I'm kind of a hoarder that way, where I just have things that I save and I go through them and I look at stuff, and it was like not okay. It was things really, I was having because I wasn't sleeping. I wasn't sleeping for months.
Yeah.
And the person that had to put up with the most was my ex-husband. And he was very supportive. And I will say I could not have done it without him. He definitely, he was there. He saw the type of mental anguish I was in. And the mental anguish, just pointing that out, is like, there's one thing to be sad, to be emotional, to be angry. But when you are just spent because you are just hurting mentally, that's a different type of feeling that people can see.
Yeah.
And
totally get it.
And my mom and him definitely saw that in me, and they're like, okay, she needs help. We're going to help, we're going to put our emotions aside and we're going to help her.
And this was after you got off them.
Yes.
Yeah. So you're really like raw dogging it, like
raw dogging it. And my aunt, who passed away just last year, my dad's only living sister, she told me, honey, it gets real dark before you see the light.
Yeah, that's so true. Yeah.
And I'll never forget that, because very true.
Yeah, it's almost like getting off of anything that you're like any substance you're addicted to or whatever.
Yeah.
Okay. Let me ask you, Katera. I think we've alluded to this. I'm guessing there's some clients or patients who you probably known, who begin taking antidepressants and they don't have any plans to get off of it. And there's others that approach it, like that bridge that would sort of gently move them out of that dark place. Um, what is the difference between somebody who doesn't use it as the bridge and somebody who uses or somebody that doesn't and somebody that does, I should say? Does it have to do with the severity of their mental health diagnosis? Have you encountered a significant percentage of people who they truly need to be on it in order to function and participate in the world around them, like comfortably?
Oh, yes. I mean, like for people who struggle with like more severe mental health issues like schizophrenia or like bipolar disorder, I mean, those individuals may need to be on medication, going like for their whole lifetime
Yeah.
because, the severity of their symptoms, they usually are really hard to treat just with therapy alone,
Right. I would
you
imagine.
know. And now people who struggle with anxiety disorders typically are prescribed like an anti-anxiety medication to treat their symptoms, but only on a temporary basis. With the recommendation to seek therapy simultaneously because anxiety is very treatable. So is depression with therapy even alone.
Hmm.
But the reason is that a number of, anti-anxiety medications that we kind of talked about earlier, like Klonopin or Ativan, Xanax, Valium, there's like, and we call them controlled substances for a reason because there's a risk that they can be, abused. Um, so I mean, like I said, anxiety and depression and other disorders can be very treatable with therapy and not, but if you pair it with medication, it obviously is more effective. Um, and there's a greater reduction in symptoms if you pair the two together.
Right.
But if but so yes, I've worked with like many clients, specifically those with like paranoid schizophrenia and bipolar that just really have a hard time managing their symptoms without medication.
Mhm.
So they need to kind of, stay on those for long term because they can't really function in life. I mean, they can't really hold a job down. They can't maintain, good relationships with others. So, I mean, overall, the two together really makes a huge difference.
Yeah. I mean, that makes sense. I would just don't, I don't ever want to be like a reductionist with this kind of thing because again, this goes back to the overprescribing. So I just think
Yes.
that it's really a situation where it's not that there are not people out there that truly need these for
Oh,
the rest of their lives.
a hundred
And then there's
percent.
those of
Yeah.
us who we need them just to be a bridge to
Hmm.
gently guide us to where we need to go and give us the capacity to make the changes we need to make.
Well, and you have to do the work yourself.
You do.
And so it's interesting because I've had conversations with doctors that have said things like, yeah, we're lazy. We're lazy individuals. It's like
It's
people come
true.
in and they want to, my doctor said to me, this wasn't too long ago. And I thought, oh, and mind you, she was just talking about me, her individual patient, and the patient she has. Because I had said, oh, I put on a little weight and I was kind of telling her something. And she's like, Maya, you are my healthiest patient. You're by far my healthiest patient. And I'm like, I am? Like, and so, not in the whole hospital, but she met her,
Yeah.
and I try so hard, every day. It's a struggle every day. Like, just to be like, feel right about what I'm trying to do. I don't always make the best decisions. But I will never, ever, ever get back on
I know, we're going to talk
antidepressants.
about that.
Yeah.
Well, and the thing too, to kind of go back to what I said, is that
Yeah.
with therapy, I mean, you're learning coping strategies.
Yeah.
So if you're just taking medication alone, you're not uncovering the whole root of the issue
Yeah.
behind why am I so anxious, why I'm so depressed. The
Yeah.
medication is going to mask that.
Yeah.
So therapy, you need to learn other skills on top of,
Yeah.
having a
It's like
reduction
the
in symptoms.
Ozempic. It's a perfect
Exactly.
example. It's
Yeah.
like learn how to change your lifestyle when you're not starving all the
Yeah.
time. It's very, very hard to diet when you're starving all the time. When you're on the Ozempic, the hunger goes away. Then at that point you can start introducing new foods and you know what I'm saying? Like I
Yeah.
feel like that's such a good, I don't know. It feels to me very relevant for right now. I don't know, do you guys, am I the only one that hears
No,
about
no,
this
No,
all the
I
time?
know. I just heard a whole episode
Oh, God, it's
the other day
everywhere.
about Ozempic.
Yeah.
In my gym, like at my gym, there's a lot of conversations about it. Okay, so going back to like the weaning that she had you do, which was skipping every other day. What is for Katera, what does this process generally look like the weaning period? The clients you've had that have been through this, because I, I would think, I mean, I think in pictures a lot of times. And so what I would think is that when you're on an antidepressant, all of you're numbed out, or not numbed out, that's really bad. The edges of your emotions are a little bit blunted or numbed, right?
Mhm.
So then when you get off of the medication, does all of that like rush to the top and you get overwhelmed by it? Or like what is the process of weaning? What should that look like? Because to me, it's the overwhelming of all those medications not being numbed anymore that I think it would scare me. I mean, it
Right.
probably scares people enough to get right back on them
Oh, it
afterwards.
does.
Not Maya in her case,
Mhm.
but
Right.
what should it look like?
Well, I mean, you have to really, the client has to communicate with their provider, whoever the prescriber is, whether it's like your psychiatrist or your primary care physician, to let them know that you want to, get off these medications. I mean, too many clients make the mistake of like just stopping them cold turkey, and you
Mhm.
can have major physical and mental health side effects. So, if you're an anxious person, you have to struggle with anxiety, it can intensify your anxiety even more so, or depression brings on more depression. And again, too, like we talked about earlier, you have to wean off very slowly and gradually, like reduce the dosage, but not like how your doctor told you to skip a day.
Yeah.
I mean, you have to gradually like kind of cut the dosage in half,
Mhm.
and kind of go for it until the doc prescriber feels like okay, it's safe enough for you to completely get off of it. Um,
But I mean, generally speaking, do people suffer through that weaning period, or is it usually pretty gentle?
See, it's hard because we're all so different.
That's true.
Our bodies
Well,
are so different.
I will just say, I'm not singling anybody out because it's been quite a few, just my own circle of friends. Obviously, I'm not gonna say any names, but I have talked to a few of my closest and people. I have a lot of close friends, tons of people. I'm so supported and loved by so many of my friends. Um, I have talked to several of them and talked about what I'm going to talk about, and they're like, "Yeah, I tried. I just can't do it.
Right.
Yeah,
That's
I
my
just can't do it.
yeah.
I tried. I can't do it."
Right.
And it's hard for me to hear that because it's like, oh, like it is hard. That's how hard it is. Is that
Hmm.
you just feel like you can't do it. And I'm gonna say I attribute my anxiety to getting off of them because what I thought about is, okay, especially now with real estate, you can't always be on an insurance. And the insurance, like,
Maya's a realtor for those of you who don't
yeah.
know. Keep going.
So the doctor, if they were to sit down and really map out, in fact, that should be like a law, hopefully futuristic, okay, so if we don't have insurance to cover this, then this is what we're going to do. Because if you can't fill that bottle, if you don't have the insurance to fill it, then what are you going to do? Who is going to
Right.
help you? Is your doctor going to help you? And so that's another reason why I was like, well, how do I stay on this? I have a ton of Alzheimer's dementia in my family,
Hmm.
a ton, so much that it's very scary. Um, but I can tell you that some of my family members were on it, and a lot of, I mean, I don't know if that's tied to it at all, but yeah, I don't. Well, I'm going to do everything in my power to try to steer away from that. That's a
I
very scary illness, and I don't
yeah.
want it.
Right, because if insurance doesn't
Yeah,
cover it, then you're forced to get off of it like
yeah,
abruptly,
yeah,
and then
Yeah.
experience like side effects.
yeah,
Well, going back to your friends, it's like nobody wants to white knuckle their way through life.
yeah,
You know what I'm
Hmm.
saying? Like nobody, I mean, that is to me, so it's like you're like it's almost like pick your poison. You want to be shot or stabbed. Like you want to be on like that's how I feel about my own
yeah.
medication too. Do I want to be relying on this medication or do I want to white knuckle my way through life? It's like it's
The
so
fine
hard.
line.
And so I'm always looking for that. I mean, for my own situation, but this mine is very similar to this even for that, how do you get off of something that your body seems to need and not be living in this desperate state of relief, needing relief all the time? And part of that is very intensive therapy, ongoing intensive therapy, but not everybody has access to that or has the funds to that. And I'm sorry, but I know I say this all the time, it's very hard to find a good therapist. I'm
It
sure you
is.
know how
Yeah,
it is not no disrespect to the therapists out there, but I feel like all the really good ones are freaking not taking new patients.
yeah,
It's so hard. Thank
yeah,
God you opened up your private practice. Everybody call Katera if you're looking for
yeah,
somebody. Get her while you can. But seriously, like it's so what do you do? What
yeah,
do you do? So I
yeah,
always feel like it's not that simple, but not to get off track, but it's just I get it is what I'm trying to say from your friends. And I
yeah,
commend you. I mean, I don't at the same time I feel like I don't know, like I feel you didn't feel more comfortable on them? You were not more? No, you're happier now. Okay.
I remember looking in the mirror when my girlfriend was trying to get me back in the gym and work out with her. My girlfriend, Gloria, she's amazing. And she helped me a lot too. She's a Pilates instructor. She lives in Vegas right now. I wish I could just give her a big hug right now. She's the most amazing person. She tried to get me into these exercise programs and helped me a lot with all the guidance. I remember looking in the mirror at the gym and just being like, is that me? Am I this big? I was huge. I was the biggest I'd ever been. And some people remember me being heavier. I still get it till this day because I've worked for the same company now for almost 20 plus years. And people will look at me and they're like, wow, you look great. You lost weight. But it's like I lost the weight in my early 30s. So that was so long ago. But I was so heavy. I had tremendous weight gain on it. Tremendous weight gain. And I was completely unaware of it. I was unaware of it until I started to try to really help myself. And I remember looking in the mirror at the gym and thinking, I can't believe this is me. Like, I look like this. And it was just, it was the unhappiness of my physical appearance. It was the unhappiness of how I felt on the inside. It was both, And then once the weight came off, I was still feeling terrible, even though I looked really good. And people, I took that leave. When I came back to work, everyone was like, oh my gosh, are you blogging? Back then it was blogging, remember? Remember, does anyone even know about blogging?
Yes.
Yeah, back then it was blogging. This one woman approached me. She's like, are you blogging? I'll read your blog. And I was like, what? All I was doing was just trying to feel better. That's all I was doing, And it was tough. Even coming back to work, it was really, really, really tough. But I felt a lot better. And for that same year, that's when everything started to change for me, when I started, okay, I got to make some really big changes. I'm going to keep this going,
Yeah. I think there's a cost there's a cost to be on antidepressants that comes at a cost.
Uh-huh.
And, in some cases there's a cost to be off them. So you just have to figure out where do you want to pay, which end do you want to pay at. So
the mental anguish that I had with the coming off of them is nothing compared to how I felt before I got on them. No comparison.
Yeah. Yeah. Okay. All right. So after you're off the medication, which of the physical side effects improved and which ones are you still struggling with now?
Well, a lot of improvement with my stomach, gut health, and bladder health too. And for me, my personal individual body, the gut health is so related to the bladder because the pressure from the, intestinal discomfort pushing on my sensitive bladder was just like a double whammy. So people hate taking road trips with me. I'm like, I gotta pee. Sorry, pull over. Yeah. So, or let me sleep. I just won't talk to you. Yeah. So that's kind of still something I struggle with, but it was really bad during the time frame of all of that because when you're not sleeping, oh my gosh, your body.
So the bladder's the worst, would you say?
I'd say they're so connected. They're both because the pressure from the discomfort from the pressure of my intestinal discomfort is putting pressure on that's how I feel. Like my body's just so connected that way. And then, I still get my menstrual cycle every month and that's horrible.
Do you feel like the sleep disturbances were?
Oh, they're so much better.
So much better.
Now when I get like 5 hours of sleep, I jump up and down for joy. Like 5 hours of sleep isn't a lot for me.
Wow.
Like 5 hours. If I get 5 hours of sleep is the most important. When your body gets the right sleep, you feel like $1 million. Yeah.
It's restorative.
Yeah, exactly.
Your mind is clear. And
I never had that before. Now I will say, like, even last night I slept pretty well. And I remember thinking, okay, I'm going to take on the day. But yeah, it just sleeping better for sure.
Mm-hmm.
I mean, the sleep got 100 million times better. And a lot of it, I gave up coffee. Sorry, everyone, but I had to. Like, you can still drink coffee in moderation, but like, man, I drank a ton of coffee.
Mm-hmm.
Yeah. I had to give it up. Had to. Yeah.
Prior to your split from your ex-husband, you decided to start therapy. I know he went with you a couple times. About 3 months in, you said you started to notice this is actually working. You were off the antidepressants at that point.
Yeah.
You guys hadn't split up yet. the therapy had started to work, what role did the therapy play in helping you heal at that point?
Well, I realized I didn't want to really be married anymore. And after my
Mm.
ex-husband started coming, I did talk to the therapist about like leaving him and like, how do I do it? What do I do? Um, and it was a male therapist at the time. And I remember just, trying my best to go and see him. He was probably the longest relationship I had with a therapist, where I just kept seeing him and it was like months into it. And then finally I was like, is this guy even helping me? And then one day he kind of said something. I was like, oh, okay, he is actually
Yeah.
helping me. And I left my husband I was almost 36 years old, so 35, just about to turn 36. But I knew that I just didn't want the lifestyle of the partying and the drinking anymore. And I wanted to focus on what I needed to focus on, was just getting healthier
Yeah.
and, feeling.
So therapy actually helped you, gave you the clarity to put your life back.
Yes. Yeah. And it did help because it was amicable. I think it was hard. But it was a relief. I didn't have the struggles that some people do have when they first split up with their partner,
That's good.
and it was,
It's actually pretty amazing considering
yeah,
what you went through with your breakup in your late 20s.
yeah, exactly.
And
He,
the difference between the two, right?
very, very different. Yeah. And even, in my current lifestyle, not everything that I'm going through, if I feel bad, if I feel sad, I let myself feel that way. Sometimes it gets a little bit overreactive, or I can go a little too far, but I'm not stuck in it.
Well, I wrote something, I didn't write it down on my
Yeah.
notes here, but I wrote something down during our pre-interview that
Yeah.
you said that I thought was really wise. And you said you have to feel to heal. And I
Yeah.
thought, or
Yeah.
one of you guys said that. And I
Yeah.
thought, it's so true. You
Yeah.
can't, you're not healing what's down there, what's buried,
Yeah.
unless you feel it.
Yeah.
Yeah.
It's
It
so
makes me
true.
wonder about the comparison. I didn't think about it until now, but if you compare your divorce to your breakup, and during your divorce, you had therapy sort of guiding you
Yeah.
and preparing you or whatever. And during the breakup, if you had sort of something similar, I wonder if it would have been different.
Yeah.
I
It
mean,
would have
just
been. I was in my
yeah.
early 20s and I just felt so just confused and just hurt, and
Yeah.
that kind of feeling where you can't escape it.
Yeah. Well, it's like everything at that, right? At that
Yeah.
age, it's everything.
Yeah. And I had never lived with someone before and I was like, oh, this is awful. So that was the kind of feelings that I was going through. But yeah.
I want to ask you, Katera, your clients who decide to get on antidepressants temporarily, what role does the therapy play in the interim to assist them in the process? Because I would imagine for some people, their emotions aren't as close to the surface to access.
Mhm.
And so how do you, if you can't feel, like we've talked about, those emotions as deeply, how are you able to do therapy? I mean, I know you're not drugged out. I mean, I'm
Right.
not under any illusions or delusions thinking like you're completely drugged, but is it hard to access? Does it become more about helping them improve their lifestyle, or what role does it play for the temporary ones?
Well, I mean, there's so many misconceptions about therapy, about like what it is. And so most people view therapy like as going to someone and just talking about their issues. Or that it must mean like, oh, I'm crazy or there's something wrong with me. But there's several ways that therapy can actually be helpful. And some examples of why people come to therapy is they just might be seeking some clarity, in some areas of their life, or if they just want to work through some difficult emotions. Or they may want to work through a traumatic experience or just learn how to challenge those negative thinking patterns. Or, learn techniques to cope with difficult situations, or simply some people just want to focus on personal growth. So it's not always about just like, here I am going to vent and tell you all my issues of
Mhm.
my whole entire life. Not every client's like that.
Yeah.
So I mean, in some sense, therapy is a way of addressing like lifestyle choices, because but you need to change these unhealthy thinking and behaviors. And the end goal is to feel better. So that's why people go to therapy.
Yeah.
But it's a process, and people get confused as like, oh, I'm gonna go a couple sessions and everything will be fine. And I always have to educate them, like, no, this is not how this works.
Yeah.
It's like going to the gym.
Yeah, depending on the person's, issues or struggles, therapy can take a little bit of time, or for some people, if they have a few things to kind of address, it takes less time.
Yeah, sometimes with you, I feel like you have the capability of almost acting like in these people with the short term need for antidepressants to help like put goals in place. I mean,
Mhm.
I have intimate knowledge of how you work as a therapist,
Mhm.
so I'm speaking to that. But like where you like go, okay, what are we gonna do this
What do you want
week?
to work
Where do you
on?
want to work? Let's
Mhm.
work. Okay, so then they don't get like homework, but they get like, okay, well, this is our focus for the and then they come back and it's like, okay, where are we at with this? And it's like you're sort of putting the building blocks in place to
Mhm.
create that foundation. So when they wean off the antidepressants, again, this is for the people that are on temporarily, they have that nice foundation that you guys have built. Am I
Right.
describing
No,
that
you're
right?
exactly
Yeah.
right. Mhm.
To me, that's
Mhm.
how,
Mhm.
and it sounds like that's how it should be for those who would just temporarily need to make that bridge. That they should be able to create something with their therapist. And that's not just this venting session where you're not
Right.
actually getting
There has
anywhere.
to be a
Yeah.
goal because otherwise people be in therapy forever. There's no goal in
Yeah.
place. And that's not the intention of therapy. So when I hear of therapists seeing clients for years, I'm like, what is going on in these therapy sessions? There's obviously no goals because this person is, especially like for things like anxiety and depression, those are
Yeah.
very treatable. So if
Yeah.
you're seeing a therapist for like years upon years, something's not working. There's what goals
That
do you have
that's
established here?
interesting because I have quite a few friends who've seen their therapists
But
for
I wonder,
years.
I, I wonder how much of them are like stopping and starting and stopping and starting because you're
That's
Yeah.
true
actually getting
too.
that
Right.
Or
momentum.
having someone they can just talk to. Yeah.
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 Before we wrap up, I want to end with something you said in the pre-interview. We were talking about mental health issues and just different struggles with like anxiety and depression. I asked you if you've ever been in a spot or a rough patch where you considered getting back on the antidepressants. And we all know your answer to this, but your response to that question was so like emphatic and what is it about? Why do you feel so strong? Because, just look, just in letting the listeners in on this, you and I talked about discussing a few different things, two different topics. And this is the
Yeah.
one that you felt really strongly about.
Yes.
What is it about it that you were like, heck no, never? Why do you feel so strongly?
I guess it was just the coming down off of it was horrific. And I'm not speaking upon, okay, there's people that have struggles with alcohol, drugs, all of those different types of addictions. And, I can't compare myself to those people that have those individual situations, but this is the closest thing I can compare it to is what happened to me.
Yeah.
And it was awful. The feeling that I had of just like it makes me emotional just talking about it. Like it was awful.
Yeah.
I'll never go back there. I'll never be on something that I have to get off of for me personally. And even with, um, you know, if I go into like I've had a few little minor surgeries and they're like, oh, we're gonna put, I'm all, no, what is that? No, I don't want any of that. Like I don't want anything that's gonna do anything that's gonna give me some type of like side effect.
Yeah.
Ibuprofen is about all I take. I won't even take a Vicodin. Like I just, yeah.
Is what's triggering about it? Is it the getting off of it part of it, or was it the being on part of it that brings you back to like the health?
I think it's both.
It's both.
Because I remember how I felt when I was on it, how I was such a different person. It wasn't me. It just wasn't, I wasn't who I was.
Yeah.
I was this other person that felt too strongly about, I don't know. It's hard because I barely remember that person because I was younger too, obviously. I was a lot younger. I was a different person. I felt differently. I thought differently. But I was on Lexapro for about 6 months after I'd weaned off and then weaned off of that again.
Yeah.
And I was seeing psychiatrists. I was seeing all these different doctors. I was seeing a sleep therapist that I really enjoyed. He was great. He still shops with me.
Maya's also a stylist.
Yeah, I had a great year that next year because I kept meeting all these physicians. I'm like, come shop with me. Yeah, it was just So that was a good year. Yeah. But do we have much time left?
we're just wrapping up. So go ahead.
Okay.
Finish your thought.
I was just going to say my last thought was when I went to go see that sleep therapist, when I did see that young girl, I think I talked to you about that a little bit.
Mhm.
It was just a young child who had severe, she was just, strapped down. She was born with severe, I wouldn't know her diagnosis, but she was not well. And I asked the doctor, I said, what, what's going on with her? And he said, well, she was born that way. She has a brain, something was going on with her brain. And he just kind of he said what he said about her. And I just said, okay, that poor little girl was born that way. And I have this working body. I have this working mind. I can do this. I can feel better. I just have to try as hard as I can. And that's what I'm always going to do.
Yeah.
Yeah.
You have a lot of will.
Yeah. It's tough, it's not easy at times.
Yeah. Well, you have a lot of will, and I think you've come a really long way.
Yeah.
I mean, out of the shadows. But I think that's life. You know, and I think we forget that. I think we forget that life, we think that like it should be easy, or why is it not easy? It's just not.
Yeah.
It isn't.
It isn't.
We all have our version of the shit that we have to go through. I mean, we all do. I have my Lyme disease and chronic issues.
Yeah.
And she has Parkinson's and you have this. I mean, we all have our versions. I'm sure our producer over here has something too. He's off camera. But we all have something. You know what I'm saying? And so I think that when we realize that the goal isn't for us to be happy all the time, our goal is to get stronger in the process. Yeah. I mean, I feel like
also want to help people at the same time. I'm never going to stop helping people. Yeah. Like there's that book about boundaries. There's several books about it. Everyone's like, oh, you've got to read this book. You got to have boundaries. It's like, I have boundaries, kind of. But the type of person that I am, it's like, I just will always be there.
Yeah.
So
you should listen to our episode from last week.
Boundaries on boundaries.
Okay. Well, as we close, I want to thank you both for being here. Thank you, Maya, for sharing your story and for giving us all something to think about. You have shared a side of this topic that I am now convinced it doesn't get shared enough, and I think it should be. We should all be given an opportunity for informed consent with every medication we're prescribed. Thank you, Katera, for joining us and giving us your perspective based on your experience with clients who have a story like Maya's. It's very enlightening all the way around. Guys, again, if you're looking for a therapist, I will leave Katera's information in the show notes for you. And Maya, we wish you all the best. And thank you for sharing your story. And thanks everyone for listening. And we'll see you back here next week. Bye. Okay. Thanks so much for watching. If you guys enjoyed this conversation, please give it a like and leave me a comment. I want to know what you guys think. Also, if you're looking for more information about how to be a guest on the show, please go to our website at humanityunlockedpodcast.com. We only record shows in person, and we are located in Sacramento, California. Oh, and if you're not subscribed, make sure you tap that button so you can get updated on weekly episodes as they go live. Is that it? I think that's it. See you guys next time.